welcome to Things to Consider Before Reinstating In-Person Counseling Services. This is a discussion that I'm going to try and lead you through some points. This is designed for mental health therapists of all kinds who are struggling with how to get back started with face-to-face therapy. This program is done in cooperation with the Michigan Mental Health Counselors Association. And who am I? My name is Larry Pfaff, as I already said. I've been a licensed professional counselor for 30 years in Michigan. My master's and doctorate are in counseling, and I've been a counselor, educator, counselor, leadership consultant, career coach and counselor, and a psychology professor. That's enough about me. Now let's get started on why we're here. So why am I doing this? Well, I've noticed, being connected with professionals through this whole COVID-19 pandemic, that as we get close to reinstating in-person services, there's a lot of confusion among therapists about who should they do that with and how should they do it and all those sorts of things. So I researched the topic by looking at what many different professional health groups are recommending, what they're suggesting. And this presentation is a compilation of all the things I was able to pull from all those different suggestions. Maybe it's the best of the best. We'll see. Let me just say something about this pandemic impact on the world. This pandemic has probably changed the world in ways we cannot yet imagine. We don't know. We're guessing at it. But we all know it's going to have a big impact on everyone. I want you to know this program is not going to address that. I know that some therapists I've heard are reimagining how their practice will be in the future. I'd like to talk about that at some point, and I'm hoping to put together a program about reimagining your private practice. So keep posted, keep in touch with me about that. But we're not going to cover that today. Here's the warning, the notice. This program is not. This program is not legal advice on how you should open your individual office or which clients you should start seeing face-to-face. That decision, when and how you will do it, is an individual office and practice decision, an individual therapist decision. You should do that in consultation with your attorney and under the guidelines of the CDC, state and local health officials, and following the ethical guidelines of your profession. What this program is, though, it's an overview of many of the things you need to ask yourself as you're going through this process. I'm hopefully going to save you some time. That's my purpose here. Help out fellow clinicians. This program, what I'm going to talk about, doesn't contain everything you should consider. But hopefully it will be a good start for you. Every office is unique, and you need to make those decisions yourself. But like I said, I hope I can shorten your learning curve on doing this. Remember, your primary objective should be to provide the best possible treatment for your clients while also keeping everyone safe. And that means everyone, your client, yourself, your family, their coworkers. Before doing anything, make sure, as I'm repeating some of this stuff already, that you check with your local health department guidelines for patient safety and incorporate those. Okay, here's the decision process. After looking at all the different sources of information and suggestions about reopening all different types of health practices, I noticed that I could take all of that information and put it into a 4-step process. And let me say up front here that before you start taking notes on everything that's in here, at the end of this presentation, I will allow you to have a free download link that will give you all the slides that are in the presentation, along with a sample consent form that you can get for free. This whole program is free, and the material in it is free as an aid to fellow professionals. So here's the process I came up with. First question to ask, and you should ask this for each client you have, is an in-person visit necessary? Not is it convenient, would it be better, is it necessary? If it's not necessary, continue with remote methods. If it is necessary, you go to step 2. What are the patient rules and the consent form? I have to develop that. So that's in place before they come in. If I don't have those rules in place, then we continue with remote. Once I have patient rules and a consent form, then you have to look at your office space, the patient office space. Do I have procedures in place to keep them safe in the office? If I don't, we continue with remote. If I have those procedures in place, then we can look at developing employee procedures. If you're in an office where there's more than one, if you're a solo practitioner, you don't have to worry about employee policies. But if you have more than one person, you have to start thinking about if you don't have those employee policies in place, continue with remote. Once the policies are in place, then you can begin in-person visits. So let's proceed from there. Now, before you do anything else, let me just say this. Again, I know this is all going to sound like I'm repeating myself a lot, but it's important. Check with the state and local health department guidelines for patient safety and incorporate those. Check the latest CDC guidelines. Check with your liability insurer and or attorney to obtain specific guidance or requirements. Incorporate those into your plan and procedures. By the way, with regard to CDC guidelines, I will also give you a link to those. Okay, step 1, in-person visit. Is it necessary? Here are all the points. Before we start on individual points, though, let me say this. Just because a patient requests or even demands an in-person visit, that does not mean you must provide it. You have to do what is best, and you are the professional. You make that decision. Questions to ask. Do they have access to technology? This would be primarily if they're a new patient and you're assessing whether you should see them face-to-face or not. People you've already been seeing remotely, they have the technology most likely. If they are currently in telehealth, how are they progressing or declining? Why do you think that is? Can you document the reasons behind it? If telehealth is feasible for next step, is telehealth feasible for next steps in therapy? Or is in-person necessary? In other words, you think that they've plateaued in the current format and you're going to need to do something face-to-face with them. Have you had discussions about the teletherapy approach with your patient and documented that? Does this particular person have mental health risks that might necessitate in-person treatment? For instance, they're suicidal or have other serious conditions. Does this person have higher physical risk factors that make in-person dangerous? If they're in a high-risk category, should you be bringing them into your office and exposing them to other people? Not just their physical risks, but what if they have family that are in high-risk categories? So you have to take that into consideration. Does their occupation put them at a higher risk of infection? So they might be bringing in the virus into your office. Does their behavior put them at a higher risk? Because you know about their behavior. Even if they're a candidate for in-person, could they still make progress without the risk? So you have to balance that, the advantages and risk. And I would suggest you consult with your colleagues about other relevant factors that they're considering, because I know this is not a complete list. Once you've evaluated each patient, you may want to start in-person therapy with some subset of your current patient population, such as people who are getting worse or are in crisis or are needing more intense care that you can't do remotely. Those are all possibilities. Then, in-person should be started with those patients where it's necessary, repeating myself, I know, where it's necessary for their mental health and you can protect the physical health of your other patients, their families, your staff, your family, and yourself. Those who don't meet that high standard should continue in remote therapy. Number 2, what are some patient rules and what should a consent form contain? Make sure you discuss with people who are going to be coming in face to face what the rules are. And you want to document their understanding and agreement to proceed knowing those things. You want to have a clearly defined set of rules for safety. Here's a couple I'll go into more later. Wearing a mask, no handshaking, no physical contact, no bringing guests. You want to have your patients agree to take their temperature before leaving home. If it's over 100 degrees Fahrenheit, they won't come in. If they don't come in, you can require that they have a teletherapy session so that you can keep progress moving. You may want to place tape lines on the floor and have rules that they follow those. You want to develop a consent form specifically. I would suggest it and sign it. I will give you a copy as part of the initial packet of materials that includes the slides. It has a consent form from the American Psychological Association. It's nicely done, but I'm just going to pull a few things from that. They will consent that to only keep their appointment if they're symptom-free. They'll take their temperature before they're coming to the appointment. They'll wait in their car until 5 minutes or less before the appointment time. They'll sanitize their hands when they enter your office. They'll adhere to distancing while in your office area. They'll wear a mask at all times, as you will and your staff will. No physical contact of any kind. They'll make sure if they have to bring children with them, that the children will follow the rules. If they are exposed to infected people, either family or others, they will inform you immediately that they have been. And no visitors. Those are some examples of the things you'd want to have included that they would check off that they read and they understand. And that's where the APA sample form, I made a couple changes to it, but it's a nicely done form, and I'll send that to you also. So step 3, we've gone through. Now we know there are certain people who we think we want to have them do face-to-face. We've got rules for them. What are some of the procedures in the office that need to take place? How am I going to do cleaning? And are there enough supplies on hand for protective equipment? Like I said, you want to wear a mask and have patients do the same. You want to develop a cleaning protocol for all areas. Have disposable masks available for patients. Arrange seating to encourage distancing. Remove waiting room chairs or place "do not sit here" signs on some of them to force people to be separated. You may want to consider physical barriers in the waiting area. You might want to increase ventilation or open windows. And again, no visitors. You may want to stagger appointment times of different therapists. So therapist 1 sees people on the hour, therapist 2 sees 15 minutes after the hour, and so forth. That way people aren't overlapping in the waiting area. And you might want to allow more time between appointments. You might want to extend your hours or days that are available so that people have more options. And again, you're only having one other person in the office at a time. If they have to complete any types of forms like new patients, have them do them online before they come in. Have hand sanitizer in every room in your office. Post notices in your office and on your website with at least these types of things. Encourage hand washing, avoid touching faces, avoid handshaking or hugging, and listing what your sanitizing procedures are so they will feel comfortable and safe and be safe. Step 4, if you have employees or there are more than one therapist, you have to think about some other things. If you have employees, you have to think about the OSHA requirements and maybe state and local requirements. Again, I'll have a link to the OSHA requirements after this. encourage sick employees to stay home, just like sick patients. Allow employees to do telework whenever possible. Maybe have more flexible work schedules, especially if people are with a high-risk family. You want to take steps to minimize employee contact with each other. Maybe reorganize space and schedules so that happens. Have enough equipment for employees, gloves and masks. So in other words, gloves and masks, especially for patients and employees. Have tissues by handy and no-touch trash cans. Get people in the practice of washing and sanitizing hands regularly. Encourage it with your patients, but you want to also encourage it with your employees. You might want to consider filtration systems for offices. Don't share computers or phones, or if you have to, sanitize between. Clean credit card stations after each use. Have gloves available to do that. Limit the number of employees allowed in common areas. You may want to also open incrementally. Start with just a very few clients until you know that you can handle it and the procedures that you put in place make sense and you can adapt them if you have to. And you want to screen people remotely before in-person visits to try and make sure that you're not bringing in people that could be a danger. And again, consult with any colleagues about other areas that should be considered. So there's the process. There it is. All the steps that it takes, the 4 steps in the process, lots of suggestions. We've gone through them all. I developed this program at the request of Michigan Mental Health Council Association. I'm glad they asked me. I'm glad to do it for fellow professionals. Visit their website, mmhca.org, for more information about their memberships and therapist resources they have available. And if this pandemic has made you start to reimagine your therapy practice and you'd like to explore your options at doing that, or you have any questions of me, you can contact me at lp@fafconsulting.com, just like it says on the screen. And here is the link to the consent form. You can go to this link, and I will place it either on the screen or a link on the screen on the video or below it, so that you can directly go and get those free handouts. Here's the link to the CDC guidelines and the link to the OSHA guidelines. Thank you for your time. I hope you found this useful, and good health to you. Thanks again.